Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. When we look at health data on community, state, national, and even global levels, we can see that some groups of people experience higher levels of illness, poorer quality of life, and earlier death in comparison to others. Groups can be defined in many ways. Some common examples include geographic region, age, ethnicity, education, and income level. These differences in health between groups are referred to as health disparities or health inequalities. Population health informs us about the distribution of health outcomes among different groups of people and can inform us about health inequalities. Population health also focuses on how and why these inequalities come about and what can be done to correct them. Access to clinical care is an important factor in determining the health of populations. But did you know that some of the biggest influences on people's health actually lie outside of the clinical setting? The culture within which people live influences their values, norms, and related health behaviors, practices, and goals. Social support and people's physical environment also influence health outcomes. People's income levels, education, and employment exert influence on their health behaviors and health outcomes as well. So, how do these inequalities in health outcomes come about in the first place? According to the World Health Organization, social determinants of health are mostly responsible for health inequalities, which are both unfair and avoidable. The World Health Organization defines social determinants of health as the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. What does this mean for you if you want to improve the health of your patients? Along with ensuring adequate access to clinical care, it is necessary to reach beyond the confines of the clinic and address the root causes of health inequalities. In practical terms, this means implementing strategies such as poverty alleviation, education, employment opportunities, improved housing, and safe and healthy neighborhoods with easy access to grocery stores and public transportation. This can be accomplished through collaborative practice to directly address the social determinants of health as well as the policies that influence them. Forming community partnerships and working collaboratively across agencies and sectors will enhance your ability to address the root causes of health inequalities. The World Health Organization defines collaborative practice as when multiple health workers from different professional backgrounds work together with patients, families, carers, and communities to deliver the highest quality of care. It allows health workers to engage any individual whose skills can help achieve local health goals. If you want to have a more significant impact on the health of individuals, communities, and even nations, think beyond the clinic. Think about collaborative practice to influence the social determinants of health and reduce health inequalities. In so doing, you will bring about improvements in population health.